Hello to all. I am Vishnu. So today I am continuing the same series as I talked about yesterday. So today I will talk about some other interesting mnemonics which comes under general pharmacology. So the next mnemonic that I am going to talk about are the substrates of CYP3A4. So you know very well that CYP3A4 refers to cytochrome enzyme, which is of a type 3A4. So there are a lot of drugs which are metabolized by CYP3A4. So please remember that the drugs mentioned here are not the only drugs which are metabolized by CYP3A4. There are many other drugs also, if you check, but just for easy remembrance, there is a mnemonic. So to remember the name of drugs metabolized by CYP3A4 enzymes, you can remember the code CT scan. C stands for cyclosporin. So there is something interesting about cyclosporin. Cyclosporin is an immunomodulator. So it is an interleukin type 2 blocker. We usually use this in, any kind of aplastic anemia. We can use it in autoimmune rejection cases to prevent autoimmune rejection of organ. So cyclosporin, always remember, it is an immunomodulator. So it has its own risk of side effects because it can cause significant immunosuppression, and also it can make your cholesterol levels abnormal. So that has been seen with many immunomodulators or immunosuppressants. So cyclosporin may also cause the same. Then we come to CCB. CCB stands for calcium channel blockers. Calcium channel blocker, you know very well, it is amlodipine, felodipine, nicardipine, nimodipine. Like that, we have a lot of calcium channel blockers, which are usually used in hypertension. And we have a special kind of calcium channel blockers, which are verapamil and diltiazem. They are usually used in the treatment of cardiac arrhythmias. If you look at the side effect of calcium channel blockers, they usually cause constipation, and they can cause pedal edema. Edema means accumulation of fluid in the lower extremities, usually in the legs. And to some extent, they have also been seen, but it is not very common. But in some extent, they have also been seen to cause gingival hyperplasia or gum hypertrophy. Now, what is gum hypertrophy? Gum, you know, it is referred to your dental area, and hyper means too much. Trophy means growth. So it will be an overgrowth of your gum. Now, what happens when there is overgrowth of your gum? When your gum is overgrown, it will start growing in between your teeth. And this gum, which is overgrowing in between your teeth, it is very soft in nature. So for example, if you are using a hard bristle toothbrush, we have different kinds of toothbrushes. We have soft bristle, we have medium bristle, and we have hard bristle. So if you are using a hard bristle toothbrush in gum hypertrophy, there is a chance that there can be bleeding because you will be using a hard bristle toothbrush. So definitely that soft gums will start bursting. And definitely that can lead to other kind of infections also due to the significant bleeding. So that is why if a patient is under phenytoin, especially it is applicable for phenytoin, and if a patient is under calcium channel blockers also, we should advise the patient to maintain their oral hygiene. Especially if they had a dental procedure or if they have any kind of problems with their gums, they should be advised to maintain the hygiene properly. Use soft bristle toothbrushes when they are under phenytoin therapy, especially, and also to some extent calcium channel blocker therapy. Then we come to tacrolimus. So tacrolimus is also a very powerful immunosuppressant, especially in liver transplant condition where the patient is receiving the liver. In those conditions, to prevent graft rejection, we use this. Terfenadine is not used nowadays because it has severe cardiotoxicity related problems. So you won't find terfenadine in the market. Then we come to statins. So as I previously explained in a case presentation on heart failure, we always have a common misconception that statins should only be taken at night. So that is, and there are exceptions. Atorvastatin, pitavastatin, and rosuvastatin, they can be taken at any time of the day because of their respective half-life. And rosuvastatin is the longest acting statin because it has a half-life of 19 hours. And pitavastatin is the most potent statin. How do you determine the potency of a medicine? Lower the dose, greater the potency. So for example, if atorvastatin is showing effect at 40 mg and rosuvastatin is showing the same effect at 20 mg, rosuvastatin is more potent. So lower the potency, greater will be, lower the dose, greater will be the potency. Then we have cisapride. Cisapride is actually a kind of antipsychotic, but it is used in gastrointestinal conditions also as a prokinetic agent. A stands for astramizole. Astramizole is also not used nowadays because of significant cardiotoxicity. And then we have amiodarone. Yesterday, when I talked about mnemonics, we talked about valproic acid. And I said that the valproic acid is the king of anti-epileptics. Similarly, amiodarone is the king of antiarrhythmics because it covers most of the mechanism of actions of antiarrhythmics. But then amiodarone also has its own share of side effects. It can cause both hypothyroidism and hyperthyroidism depending on the thyroid status of the patient. It can cause pulmonary toxicity. So that is why patients are advised that if they are under amiodarone therapy and if they are feeling breathless or they are experiencing cough, which is not resolving at all, and if they are experiencing breathlessness, they should stop the medicine immediately and report to the physician or pharmacist. Like that, a lot of side effects are there. Amiodarone usually causes cough also. So that is also very significantly seen. Then N stands for NAVIDs. So NAVIDs are usually protease inhibitors, and protease inhibitors are used in the treatment of HIV. So we have ritonavir, saquinavir, like that. Many medicines are there. TDM is required for. TDM means therapeutic drug monitoring. So what do you mean by therapeutic drug monitoring? Therapeutic drug monitoring refers to those kind of medications. If the dose reduces by an inch, it will not show its effect. And if the dose of the medicine increases by an inch, then it can cause severe toxicity. So those kind of dangerous medicines, if the plasma drug concentration increases a little, it can cause problems. And if it is reduced a little also, it can cause problems. So those kind of drugs require therapeutic drug monitoring. So if you are in your 5th year PharmD or if you have already finished that, you know that there is a chapter called, there is a subject known as TDM. So there you have to study the TDM of a lot of drugs. To remember the name of drugs that require TDM, you can remember the code, a drug possessing low therapeutic index. So A stands for aminoglycosides because aminoglycosides usually have very notorious side effects. Aminoglycosides are nephrotoxic in nature, especially they can cause interstitial nephritis, tubular necrosis, acute tubular necrosis. Aminoglycosides are autotoxic in nature, and in some cases, the autotoxicity is irreversible. So hearing loss can be irreversible also. And aminoglycosides also cause neuromuscular blockage. So that is why if surgery is being conducted on a patient, so before the surgery, we usually give a surgical prophylactic antibiotic. So if aminoglycoside is given before the surgery, you should avoid the same with neuromuscular blocking agents. For example, vecuronium, succinylcholine, etc. Because if both these agents are used together, there can be increased risk of neuromuscular paralysis. So these are the side effects of aminoglycosides, the interesting thing. There is one more interesting thing that I want to tell you about aminoglycosides. Usually, you know very well that aminoglycosides are used for bacterial infections. They are usually active against gram-negative organisms. Against gram-positive organisms, they don't have much of an action. Maybe streptococci or maybe some agents like that, they may show some action, but they are usually active against gram-negative organisms. But there is one aminoglycoside which is not antibacterial in nature. It is anthelmintic in nature, and that is paromomycin. It is a newer aminoglycoside. It is effective against worms. There is another specialty of this paromomycin. Most of the other aminoglycosides, usually we take it parenterally. Because if you are taking aminoglycosides orally, the problem is that due to its medicinal chemistry structure, the absorption in the stomach becomes negligible. That is why, or it is easily broken down by the gastric acid. That is why we usually use it parenterally. But paromomycin can be given orally. So that is one interesting thing about aminoglycosides. Paromomycin is the only aminoglycoside which doesn't act against bacteria, it acts against worms. Then in that drug, the D stands for digoxin. So digoxin, you know very well, it is a agent which is used for heart failure. It is just used for triggering the heartbeat, and then for maintaining that heart rate and everything, you require other medications also. Digoxin is also a medicine which requires therapeutic drug monitoring. It can cause color blindness, halo-like effect. You know what is halo? Halo means, for example, whenever you see the pictures or images of God, there will be a circular ring around. So that is called halo. So the same thing you can experience when you are under digoxin therapy, especially if the dose is increased. So that is why we have to be very careful. And digoxin causes a lot of other issues also. Then we come to phenytoin. I have explained very well about phenytoin yesterday. What are the interesting features about phenytoin? You can remember, or you can view my yesterday's video and you can note it down. Lithium is another agent which requires therapeutic drug monitoring. It is actually given for mania. It is usually given for mania. To some extent, maybe bipolar disorder, mainly given for mania. And lithium has another specialty also. It can be good for depression. I'll tell you the reason why. There is a factor. Whenever you look at the motivational speakers, they talk about a factor which is known as BDNF. BDNF's full form is brain-derived neurotrophic factor. This is actually very good for stimulating dopamine and serotonin in your brain, which is good for your day-to-day activities, and you will feel good about yourself. But there is an enzyme in our body which is known as glycogen synthase kinase 3, GSK3. That enzyme breaks down BDNF. So what happens if GSK3 breaks down BDNF? The amount of serotonin and dopamine in your brain will be reduced. So that can lead to depression. That is why motivational speakers talk about morning walks, getting up early in the morning, doing some kind of aerobic exercises, because all these activities increase BDNF. Lithium has a specialty. Lithium will block this GSK3. And that is why in the long term, it may be good in the treatment of depression if it is also associated with bipolar disorder or mania. But lithium we directly don't use as an antidepressant, because lithium, even if the dose increases a bit or reduces a bit, there is a huge risk of side effects. Lithium can cause very severe dehydration. That is why patients who are on lithium are always advised to drink good amount of water. Because of the severe dehydration caused by lithium, it can also lead to acute renal failure. So that is another matter of concern. So like that, lot of issues are there with lithium. Then we come to tricyclic antidepressants. I have already said that before. Tricyclic antidepressants have three kind of problems. First is they are H1 blockers, histamine type 1 receptor blockers. So that can cause sedation and weight gain. That is why this should be taken at night time. It blocks the alpha-1 receptor, so it can cause sexual dysfunction. It can cause postural hypotension related problems. It also blocks the muscarinic receptors, so as a result of which it can have anticholinergic side effects. So it can cause blurred vision because the fluid in your eyes will be reduced, so it can cause blurred vision. The saliva in your mouth will be reduced, so it can cause dry mouth and bad breath. The sweat glands will not function properly, so the toxins will not get eliminated from the body, which can lead to fever. It will not allow the urine to get eliminated from the bladder, so it can cause urinary retention. And if you are already a diabetic or recurrently suffering from urinary tract infection, which usually happens in females due to hormonal problems or whatever it is, then it can lead to urinary tract infection as well. And it will not allow the waste materials to go out from the stomach, so it can lead to painful constipation. Painful constipation because it will lead to abdominal pain as well. And definitely anticholinergics have another problem also. They cause memory loss. And that is why tricyclic antidepressants should never be used in elderly unless it is urgently required or seriously required, because elderly, they usually have a high risk of dementia and Alzheimer's disease. And there, if we are using tricyclic antidepressants, the dementia or memory loss can become worsened. So these are the different problems of tricyclic antidepressants. And also it can cause cardiac conduction abnormalities. So it can lead to QT interval prolongation and like that kind of things also. And then we come to immunomodulators. So for example, cyclosporin, I already explained that before. Now we come to the drugs that cause SLE as a side effect, systemic lupus erythematosus. So I have said before, it is a notorious kind of autoimmune disease. What do you mean by autoimmune disease? Autoimmune means automatic immunity. That means your body's immune system will consider your own body as enemy and will start sending antibodies towards the same. So if it is systemic lupus erythematosus, we can't predict what the symptoms may be, because the symptoms can happen at any part of your body. So there are some drugs which can cause this kind of autoimmunity in your body. So to remember the name of the drugs that cause SLE as a side effect, you can remember the code SHIP, or you can remember the code Queen of SHIP. So Queen, the Q stands for quinidine. Quinidine you know very well. S stands for sulfonamide. Sulfonamide are antibiotics. H stands for hydralazine. Hydralazine is a very powerful vasodilator, and hydralazine should only be used in very severe refractory hypertension because of its high range of side effects. And hydrochlorothiazide. Actually, this was a very recent report. In 3 years before, it was actually published in a case report that hydrochlorothiazide can cause SLE as a side effect. So that is why I mentioned that also. I stands for isoniazid, which is an anti-tubercular agent, and P stands for procainamide. So these are the different drugs that can cause SLE. There are other drugs also, but I just made it in the form of a mnemonic. So this is actually the case report in which it is explained. You can refer this case report. I have just made it as a screenshot. So you can refer it, and they have explained in detail what hydrochlorothiazide, why hydrochlorothiazide caused SLE, etc. Drug-induced hemolysis in G6PD deficiency. So G6PD deficiency is an enzymatic disorder. Its full form is glucose 6-phosphate dehydrogenase deficiency. So if you are lacking G6PD in your body, you will have hemolytic anemia. So if you have studied PharmD, 4th year therapeutics, there is a condition known as drug-induced hematological disorders. And if you refer the book Dipiro or Dipiro only, Then the third disorder that comes in it is hemolytic anemia. Hemolysis means, usually you know very well that the RBC has a lifespan of 120 days. After 120 days, it gets destroyed. But in hemolytic anemia, before 120 days, the RBCs will get destroyed. But the newer RBCs will be formed only after 120 days. So normally what happens after 120 days, RBCs get destroyed, and during that period, the next RBC forms. But in hemolysis, what happens? There is premature death of RBCs, but the new RBCs are formed very late. So there is an imbalance. So there are some medications which are contraindicated in patients who are having G6PD deficiency. Otherwise, it may cause hemolytic anemia. To remember that code, we can remember PINS MCQ. So P stands for primaquine. Primaquine is an antimalarial. I stands for isoniazid. N stands for nitrofurantoin. So nitrofurantoin, you know very well, it is a very good choice of anti-urinary tract infection agent. It is used against urinary tract infection, especially against E. coli, Escherichia coli. Nalidixic acid. Nalidixic acid is actually one of the first fluoroquinolones. Actually, it is a quinolone, not a fluoroquinolone. But nalidixic acid is not nowadays used because there are better agents available. S stands for sulfonamide. Sulfonamides are contraindicated in patients with G6PD deficiency. M stands for menadione. It is a vitamin K derivative. C stands for chloroquine. Chloroquine is an antimalarial. And Q stands for quinine, which is also an anti-malarial. Most of the antimalarials, if you look at their side effect, they usually cause hemolysis. Now we'll come to the autonomic nervous system in the next day. I hope this MCQs that I have discussed today have been useful for you. Tomorrow I will come with the autonomic nervous system where I have made some MCQs. So tomorrow I'll be discussing about that. So I hope I have been of service to you today. And if you have any clarifications or doubts, you can put your clarifications or your concerns in the comment section, or you can contact me at LinkedIn. My name is Vishnu R. Nair. You can contact me at LinkedIn. I'll be very happy to be of service to you. Please make sure that you note this all points down. Just note these points, and please make sure that you study smart. If you appreciate my efforts, then please share and subscribe to maximum people. I won't ask you to like the video, but I definitely would like to ask you to share the video if you find that this is relevant. Because as I always say, that knowledge is power, and knowledge shared is knowledge doubled. So that's it for today. I'll be back with part 3 video tomorrow, in which we'll talk about mnemonics in the autonomic nervous system. So until then, it's goodbye and see you tomorrow.